I am Sister Mshweshwe. I'm a pediatric nurse by profession. In this project, I am the coordinator. I'm responsible for making sure that all contacts of index patients that are admitted in the hospital are put either on treatment or on prophylaxis. After the investigations that we've done, then we decide if the child has got no signs and chest x-rays are clear, gene expect negative, then that child, if the child is under 5 years, then that child is put on prophylaxis. And then if the child has symptoms and either positive sputum, then the child is started on treatment. Usually we admit them for the first 2 months, but at times you get parents that would not want admission. So for those, you call them every week just to make sure that you supervise treatment, and they must come, and you want to make sure that they are reliable, they are going to be able to give treatment at home. Pediatrics, this is what I've done all my life in nursing. Even in the hospital at Livingston, at Dora, I was doing pediatrics. So child health is my passion in nursing. Qinisela, for me, it is a step forward in terms of making sure that all children that have been exposed to TB, especially MDR TB, are found and are started on treatment. I see Dr. Dimpo did indicate in the previous interview that the problem is that there is a lot of patients that are admitted, but the children, we've got few children that come. So it is very important for us now with this project to make sure that we find those children and we make sure that they are started on treatment. Those that qualify for prophylaxis are started on prophylaxis, that is preventive therapy. So Qinisela is there to make sure that those things happen. There are a lot of challenges, like what the names, we get those names from the files of the patients that are admitted. Sometimes you get to the home and the patient that we were told in hospital that the patient is 4 years, the patient is 18 years, or the patient is 19 years. So, or you get to the home, the patient is no longer staying, this child is no longer staying in that address. There is a child now that is here. We tried to find that child last week, and when we got to the home, we were told that the child has been taken by the mother because she's staying with the father. But now the brother to the father is on MDR treatment at the hospital. So when we got there now, we were told that the mother has taken the child. They do not know the mother's address. But fortunately for us, the child is here today. We are very happy. So those are some of the challenges, because our patients are moving around a lot. We have a lot of highlights, and you feel so good when you are there and you see that you are needed. I think the case that I can present is the patient that we went to fetch this morning. Child-headed family. Those are the challenges that we need the intervention of the social worker, we need the intervention of the psychologist, and we need to be visible to reassure them and assist them and make sure that their problems are sorted. So those are the things that you think that if you were not there with this Qinisela, who was going to found this family? Because we found this family through the Qinisela project when we were going out to actually physically look for these children. The community, I think we need to educate our community to know that it is very important that contact tracing. So if there is a mother or a father in the house, and there are children in there, those children must be screened, tested, either put on prophylaxis if they qualify or started on treatment, because children are the vulnerable group. You want to make sure that our future, because children are our future. If we don't look after our children, then we are going to have a sick society. So it is very important that we make sure that the child in the house is taken care of. If he needs treatment, treatment must be given, and we need to make sure that we look at our children holistically. Well, I would thank Aquity Innovation, Janssen, and for this project. We need this in Port Elizabeth. This is going to really assist. Already we have admitted 5 children, and we have started children about 10 now that have been started on prophylaxis, just with this project that we were doing. So you can imagine if we can continue with this program for a year or 2, it will make it a great difference to the community of Port Elizabeth. We are really grateful. Thank you very much.